Hi, my name is Kurt Matherin, and the career interest field that I've chosen is physician assistant. A physician assistant is national certified and state licensed medical professional. They work along with various medical professionals such as doctors and surgeons. A prerequisite of being a physician assistant is a bachelor's degree in natural science. Gaining this degree will be the first step in becoming a physician assistant. A physician assistant is a medical professional that assists surgeons and physicians. I chose this topic because my passion has always been helping people medically. The field offers multiple job opportunities, and the income generated would be very lucrative. This presentation would indicate the role, responsibilities, educational prerequisites, and how long it takes to become a physician assistant.
Physician assistants are healthcare providers that work with a team of nurses and physicians to help to treat patients. I like the variety a PA has. For instance, I work in dermatology, but if I needed to moonlight in an urgent care setting or an ER, I can do that. What I also like about my job is the hours, at least in my particular field, are pretty decent. My days are usually about 7:30 to 5:30 whenever I get done with paperwork and patient phone calls. What I don't like about the profession is just the amount of education I think the public has about PAs. And it's to no fault of their own, but some people will say, so are you a doctor or are you not? Or they'll confuse us with like medical assistants. The way a PA relates to the rest of the healthcare team is we're considered mid-level providers. So a PA works under the license of a physician. A lot of things a PA can see by themselves. We can prescribe medications, we can perform procedures. As long as it's something that your supervising physician is comfortable with you doing and has trained you to do it in a proficient manner.
Prerequisites of becoming a physician assistant. Entrance requirements to PA training programs vary, but those who get admitted usually have a 4-year college degree in science as well as experience working in a healthcare related job. After earning a bachelor's degree, some students go on to complete a 2 years master's physician assistant program. PA programs include classroom and clinical instructions in anatomy and pathology. After completing a program accredited by the ARCPA, graduates must pass the Physician Assistant National Certifying Exam. Only those who graduate from an ARCPA program may sit the exam. The test is 5 hours long and consists of 300 multiple choice questions designed to assess basic medical and surgical knowledge. Graduates of a PA program need to pass the Physician Assistant Certifying Exam and obtain a state license before they can practice. How long does it take to become a physician assistant? If you currently have are working on your bachelor's degree, your next step is to apply to a PA program. PA programs typically take between 24 and 27 months to complete. So it will take you about 2 years to become a physician assistant. The standard degree for practicing physician assistants is a master's, which means you'll need to spend 4 years in an undergraduate school obtaining a bachelor's, then 2 more years to get the professional degree. PA needs a 4-year degree, 2 years of PA program, and 3 years experience in the healthcare field, which equals to 9 years to begin practicing PA. What are the responsibilities of a PA? Physician assistants practice medicine under the direction of physicians and surgeons. They are formally trained to examine patients, diagnose injuries and illnesses, and provide treatment. PA counsel patients on preventive care, conduct examinations, write prescriptions, and assist surgeons. PA responds to health emergencies, establish basic treatment plans, and elicit a comprehensive health history. They also collaborate with other members of the patient's healthcare team in order to provide an appropriate plan of care. What roles does a PA play in modern medicine? The distribution of PAs also varies by metropolitan status. PAs are more likely to work in an urban setting than rural ones. Usually, the larger the metropolitan area, the greater the concentration of PAs. PAs promote quality, cost-effective medical care to all members of society. Physician assistants emerged in the 1960s as a response to a shortage of doctors. In some specialties, such as family practice, there continues to be a shortage, especially in certain communities. Physician assistants continue to feel a need. According to the Bureau of Health Statistics, the median income of physician assistants in 2010 was $41.54 an hour, or $86,410 annually. This tab is the resource tab that outlines my resource sites. This is the end of my presentation. Thank you.